So poverty remains a huge problem in Ohio, and it's something you've been engaged with for many, many years. Even when in your various career moments when maybe you weren't dealing with poverty directly, poverty was framing a lot of what you would work with. We've learned over the past few months, and again the last weeks, there was release of some new census data, that poverty's on the rise in Ohio, and we've talked about this on the show a bit. The end of certain pandemic policies are certainly playing a role, and we were really afraid of that. Community Solutions has done fantastic work and kind of sounded that alarm really early on. Where do you think Ohio stands with regard to poverty? And when you think about it, with the hindsight and thinking about all the experience you've had over the years, where are we, and what are the areas that we need to be really focused on? Because we can't do everything. So if we can just do a couple of things, what would they be?
Well, I'd maybe focus on two populations first. I'd focus on families with children first. And I think there's two ways that we could help people. One, we could raise the minimum wage in this state. We have a higher minimum wage than the federal level, higher than a lot of other states.
That's not saying much, though.
Yes. And I mean, the census data showed that, I think there were 50,000 Ohioans last year who worked full-time and who were still below the poverty level. That's just not right. That's not right. And so I think that's one thing, raise the minimum wage to a higher level. And two, I think, let's adjust some of our tax policy and stop penalizing, poor working families. We're one of the few states that has an earned income tax credit, a state earned income tax credit that's not refundable. If we could make that refundable, raise the minimum wage, it would also go a long way, I think, towards addressing the benefit cliff. That scenario that we have now where people are afraid to advance because they don't want to lose their benefits. We've got to tie it to higher wages and better tax policy for those families. I think the other group that we've got to think about, and I'm not sure we have great answers yet, is around older adults because, actually child poverty is down from where it was many years ago, but poverty among the older adults, the aged, has gone up and is continuing to go up. And I would expect that it's going to continue to go up, as pensions have disappeared, as, the average person, I think, what do they say, in their 401k maybe has $150,000 or $100,000. You would spend that in 1 year, more than that if you were in a nursing home, for example. It just goes so quickly, and for, prescription drugs and things like that. So I think we've got to think about, what can we do in that population? Is it, at the federal level, maybe raising Social Security benefits and, raising the payroll tax so that we can afford to do that? I don't know, but that's a group I'm worried about because, if you think back to the founding of Medicare and Medicaid, well over 50 years ago, I think at the time they realized that wages among older adults are generally much lower. They're not working as much, if at all, and they have many less hours. And so work isn't necessarily the key to this. It may be part of it. More flexibility for older adults around jobs, less, more part-time work and things like that. But those are the two populations, and particularly the last one, older adults, because it ties into increased healthcare costs. Yeah. There was some research that was done at Johns Hopkins a few years ago that showed that if you just spent $10 more in SNAP benefits for an older adult, a dual eligible, a low-income older adult, you could reduce their time in hospitals and nursing homes and EDs and all that stuff. So, so maybe there's a way, it's always hard when you save money in one program and spend money in another to try and move dollars because dollars are not very fungible in some of these programs. But I think we've got to try and think about some other approach, I think, for older adults.
Yeah, it sounds so simple. We've talked so many times on this show about policy tweaks that seem, they're pretty easy actually, but convincing people to look one place and get a benefit in another, and the fact that we actually are living in a dynamic society, but budgets don't work in dynamic ways oftentimes. And territorialism can shut that down quickly.
I think you're right. And that is, the point with a lot of these issues. I know you and I have talked about, one of the other things I'm interested in, the federal government has become seemingly much more open to states looking to, improve the health care they provide in their correctional facilities and letting those people be on Medicaid. We have a federal prohibition, in the federal law that says if you're incarcerated, Medicaid kind of doesn't turn off, but you generally can't use it for health care services. And they're becoming more flexible on that. And, that could save money, for counties and cities and states
Right.
who spend millions and millions of dollars now on correctional health care. I mean, you just think about it at the state level, how many people, I mean, some of our prisons will come to resemble nursing homes because they'll have so many people who are there for long periods of time
Right.
who get older and get sick. So the healthcare needs are pretty significant. But so it might save some money one place, but then how do you invest that money to maybe kind of close that front door a little bit, so that people aren't cycling in and out so often?
And, this is a simmering crisis in the sense that Ohio is an aging state, right? And you just look at the demographics. It's interesting. You talked about families with children, and then you talked about older Ohioans, right? And it's interesting because, I teach at a medical school where very few of my students want to go into geriatrics and work with. They don't really think about that early on. And yet we have all these students who want to work with kids. And this just shows how we've shaped kind of where our values are. At the same time, that's not really where the action are. I mean, most kids are pretty healthy, but an aging population that luckily our life expectancy is improving. But as it improves, it becomes more complicated and it's a bigger puzzle on the health side. So, I really I think that's going to be something our state's going to have to figure out. And also, we're going to need more people to value it. We're going to need more people to look at this population and say, and you mentioned even within a prison, I mean, it's kind of everywhere, and COVID brought some of this out, but
Right.
we're not headed in the right direction there.